My name is Andrea Leland. I am the chair of the Special Benevolent Fund Committee, and I am calling to order this July 16th, 2020 meeting at 2:04 p.m. Before we begin, I need to read a statement due to our meeting being held remotely. The open meeting of the Board of Trustees of the Special Benevolent Trust Funds is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a public, accessible physical location. All members of the Board of Trustees of Special Benevolent Trust Funds are allowed and encouraged to participate remotely. The order allows the Board of Trustees of Special Benevolent Trust Funds to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. The members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed in the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. With me are the other committee members, and please respond so that we know you can hear and view this meeting. We have Marcia Roman.
Present.
Karen Skopetsky.
Present.
And we are also very fortunate to have the following town staff in attendance. We have the Director of Family and Youth Services, June David Fors.
Present.
Counselor with the Family and Youth Services, Ayako Rish.
Present.
We also have Financial Director and Town Accountant, Jason Little.
Present.
Director of the Senior Center, Liz Triak.
Hi,
Did I
present.
say that appropriately? Okay.
Triak.
Triak, all right. And we are honored to have with us the Executive Director of the Interface Program, Margaret Hannon. Margaret, can you unmute and just say that you are here?
I am here. Thank you.
Thank you. Thank you. All right, so we will begin with the first item on the agenda, which is the review of the March 11, 2020 minute meetings. Have the other committee members had a chance to review those minutes?
Yes.
Yes, I have.
Yes, and we have to take a vote by roll call. So Marcia, do you have any changes to the minutes, or would you like to approve them as they are written?
No, I approve as written.
And Karen, do you have any changes to the minutes, or would you like to approve them as written?
I approve.
Okay, and I so approve the minutes of the March 2020 meeting as written. Next on the agenda is the discussion of the request by June to fund the William James College Interface Referral Service. So I will pass this over to you, June.
Thank you. I'm very pleased to have this opportunity to talk about this program because it's, if funded, it's going to meet so many of our needs. So I first talk about the statistics overall throughout the country. And if I can just make a few notes about, I think most of you received the reports from different organizations. So there's a couple themes that goes on that even though different reports note them, I want to highlight them because it's the very same experience that Northborough Family and Youth Services has gone through, and also the schools. So on a nationwide basis, there is a significant increase in the number of people presenting with mental health issues. We have seen an increase overall with people coming to our department because other than counseling, we provide fuel assistance, we make referrals for food and other programs. And so we've also seen an increase in people seeking help for those things. The graph I included It shows the statistics for the growth in our department over several years. And even though it's not broken down by program, we definitely have seen an increase in needs for mental health services at a time in which there's a lack of sufficient providers. So for instance, in 2011, we served 643 families, and then in 2018, it was 954 families. So our statistics speak to that. In the Mental Health in America report, they talked about the support that's needed for mental health services. And they talked about the unmet need for youth and adults for getting therapy. And the percentage of adults who did not receive mental health treatment was 56%. This is nationwide. And the percentage of children who didn't was 61.5%. The ratio throughout the country of clinicians and providers is 504 to 1. So that also speaks to the need for more providers. The barriers with this increase have been the lack of providers, and psychiatrists, especially for children. It's very hard to find psychiatrists that treat children. And our clients tell us about the long wait lists for services. The Elementary School, National Association of Elementary School Principals, they do a study every 10 years about the concerns of the principals. And this last study showed the number one and number two concern was the increased number of students presenting with emotional problems and student mental health issues. We hear this from the schools in Northborough. In fact, this is a challenge because of the lack of providers, but they have seen kids as young as elementary school be hospitalized for mental health issues. And the problem is when they get released, I mean, it was, there's very few in the elementary school, but through the high school and middle school, there's a significant number. And the problem is it's difficult to find providers for them. We do go into the schools and provide the counseling for children. And that really helps in terms of families who can't get their children to appointments in the office. And for those cases that we work closely with the schools on. But there's myself full-time, and I have a lot of administrative duties. Ayako Rish, who's with us today, she's a part-time counselor. And we have a office assistant, Kate Gonzalez, who takes care of a lot of the case management issues. But both Ayako and I's caseload fills up very, very quickly. And in the past, I've taken on about 20 counseling cases and then a handful of case management. And Ayako, probably 11 out of her 19 hours is clinical work. So when we jammed up a couple of years ago, we had to make the difficult decision to start a wait list. And what's difficult about that is we're seen as the last resort for families. There's many families who cannot afford the increased cost of deductibles and co-payments. So we've been an important resource for them. There's also some statistics which I found surprising. They listed the states and the percentage of youth who did not receive treatment. And I was surprised to see that Massachusetts is number 15 on the list, with 54.5% of youth not receiving treatment. The reason I was surprised about that is we have great insurance in Massachusetts, and we have a lot of providers, but there's a lack of providers that treat children. So I think that attributes to that also. The National Alliance on Mental Illness is the major voice for mental health issues in the country. And similar to the other statistics, 1 in 5 adults experience a mental illness, 1 in 25 experience a serious mental illness, and 1 in 6 youth ages 6 through 17 experience a mental health issue. And these stats were from 2016, so I can only imagine that they have gone up. As I said, because of all the barriers in the way, many of the adults and the children have not received the treatment. The other thing is that in the emergency rooms, 1 out of 8 emergency room visits by adults has to do with a mental health issue. This was back in 2018. You know, the cost of mental health illnesses was $193 billion. The other thing is even though adult statistics have remained steady, it's the second leading cause. Suicide is the second leading cause of people ages 10 through 34. And suicide is the 10th leading cause of death in the United States. On a local level, Metro West Community Health Foundation did an assessment, and they've been a phenomenal resource to us. They give many grants out to communities in the Metro West area. And a few years ago, I got a part-time clinical position through them, which was great. It was very rare. They don't usually provide staffing, but this was during a time when the needs were exploding, and they offered that. The top 5 concerns in 2019 for youth was substance abuse and mental health issues. And this was flipped since 2013 because overweight and obesity and aging issues were in the top 2. So you can see here too that things are growing and impacting communities. And then finally, this has impacted our department because we've had to make some difficult decisions over the past couple of years to start a wait list. You know, the good news is we have a good reputation out there, but the bad news is with more and more referrals, we just can't keep up with it. We will help people try to find a counselor. And what we'll do is find out what their insurance is and look for providers. But they tell us that they have to wait like three months up to a year. So I'm going to talk about interface, but the bottom line is if the town had that service, the entire community would benefit, the schools, our department. There's nothing more painful for me to get a call about a family in dire need and having to say, we can't treat them. And the schools and the community have relied on us a long time. So for me to have another option in which I can say to families, you know, we can't take you on right now, but we have this wonderful service that, and this is key, Interface is able to find a clinician as soon as 2 weeks. It's not in every case, but they have a huge database. They utilize, they have affiliations with throughout Massachusetts for clinicians and providers, and it's an extensive database, and they update it on a regular basis. So that would be huge for us to have as a resource. In addition, if we contract with them, anyone in the town can call them for help. So it doesn't have to go through us. It doesn't have to go through the senior center. So that also is a wonderful, wonderful benefit to have. I meet on a regular basis with other youth and family services departments, and many of them, several of them have a contract with Interface. They are very, very pleased with it. They also feel like it gives them a relief to know that they can refer people to the program, because most of the youth and family services departments are pretty small in staffing. So I'll talk a little bit about what Interface can do. So overall, it's a mental health and wellness referral helpline. So as I said, anybody can call Monday through Friday, 9 to 5. They will be assigned a resource and referral counselor who will help them to navigate finding a provider. And as I said, they have an extensive database of providers. Just over the past year, our department had 28 families and children who are on the wait list. So this will absolutely provide relief for our department to know that we can refer people there. So when the resident calls and they get hooked up with this counselor, the counselor will stay with them through the process and until they find a clinician, or even if they'll follow up, and if it's not a good fit, they'll work with them to find a different one that might be a better match. So just as an example, the communities that have this is Westboro, Westwood, Acton Boxborough, Chelmsford, Concord, Holden, Holliston, Littleton, Lunenburg, and there's plenty more, but I was looking for ones that are close to us. Medfield was another one. So when we all meet, they talk about it. And the other thing is you get a very extensive report from them. So we'll be getting the data back from them, and the contract, the cost of the contract would be, you have to do a 2-year contract, and the cost would be $16,000 a year. Once the town contracts with Interface, then, as I said, anyone in the community, an organization can call, anyone in the community can contact them.
I have a question. Are they charged again, or do they do health insurance?
I'm sorry?
Do they,
What was
that cost, is that the only cost? Or does that person get charged?
They go through their insurance.
Okay.
Yes. So that's for the contract, the town, to be able to contact them. So not everybody can just call. You have to have a town contract.
And then if you don't have insurance?
Well, some of the people will be referred back to us. And maybe Margaret could speak to that a little bit, because on that end, I'm not sure what happens.
Sure. So what we'll help them navigate getting insurance, because that would be the best solution for individuals. But yes, as June says, we would then refer them back to the town. What is been helpful from the town reports that also have a youth and family services is that when we need to refer the client caller back to the town, it's become much more of a partnership. So it's, if in the intake from us, we discover that this isn't going to work for the individual to actually get insurance or to get the services they need, then because of the partnership that we would have with Youth and Family Services, is that then we would have the opportunity to sort of talk about this particular case and work it out in a more individualized basis. And I think that that's, June, probably what you learned from some of the other of your colleagues, that the referrals that do come back are ones that are very targeted and absolutely the right ones that need to be within Youth and Family Services. So
And
there's,
so they take Mass Health?
well, if that, yes,
You
if,
take Mass Health?
well, we aren't the providers of the service. If
Okay.
the individual caller has Mass Health, we know how to help them get a Mass Health clinician. Is that it?
Which has really been a problem for us because there's not that many providers. Not many people will take Mass Health. And, you know, as Margaret said, just navigating that system and getting people on, it's extremely complicated. So to have a partner who can help them with that is tremendous.
Right.
But that's been a challenge. There's either a lack of Mass Health providers or, again, long wait lists.
Right.
So how do people, you say you have this network within the Friedman Center, so to speak. Do providers pay into that to be part of your network?
No, we don't. And that's purposeful, that we don't have providers pay to be on our database. With providers not paying, then we have a more diverse database. Any clinician out there has to make their own financial decision about how and if they'll join referral services. And Interface has a long history of not charging purposefully. We're part of William James College, we're a nonprofit. So the benefit of being part of a school of psychology is that we're able to keep our costs low. And this isn't about sort of benefiting from the revenue of this. This is about doing good, if you will, and also having the opportunity for our students who are graduate students of psychology to also learn what it's like to be in this role. Because as June can attest, and I'm sure Ioka can too, is that your job as a clinician often becomes referral. Yet when you're in school to become a psychologist or a mental health counselor, you don't always learn that side of the business, if you will. And it's a very important side of the business. So that's one of the benefits that William James College has for us having this service. I'm wondering if I answered your question.
You did, because I'm just seeing, so you were basically just a network of providers where if a family in Northborough calls June and obviously there's this great need and June just can't get to it, you would be the resource. They would call you and say, this is the situation that I'm in, this is the type of insurance I have. So you basically do all the research to try and match them up with a provider. So it's freeing up June and her group to do that. My question would be if someone in Northborough is looking for someone, and June has already run into this problem with there's so few clinicians and mental health experts within the area, how are you going to provide more assistance without making these people who now are struggling go further than a network that is reasonable for them?
Right. So what June is describing in terms of lack of providers is absolutely true within the country. Yet at the same time, there is many clinicians this isn't the business they're in of doing the matching. So it's really it's an art and a science to do the matching. So Massachusetts has the highest number of licensed clinicians out of the entire United States. Not all of them take all of the insurances, yet over the years, we've become very expert at insurance and at matching and in finding every provider out there, looking under every rock, I sometimes say, that Sure, I'm sure June could do that work if that was what she did all day long. Yet this is what we've discovered in creating this program since 2007, is that this is actually a role in the world, that this is a full-time role, because the individual who calls, they don't want to have to tell their story to
Right.
individuals. So that's the work that we do. We make the calls to all the providers, and until we have the match where the provider takes their insurance, has an opening, is an expert in the particular issue that's presenting, and is located in the area that's convenient for the individual, we don't pass that match on. So I'm sure that at times June would have to give just a name that they took the insurance, but probably didn't have the conversation with the provider about, yes, this looks like this might be an expertise of yours, yet do you want another particular case on your caseload that has this presenting issue? And so we do a therapeutic intake that allows for us to understand what the presenting issue is, so that when we talk to the provider, our referrals are very well matched. And that's why we have clinicians on our line as the resource and referral counselors.
And
Okay.
although we would love to be able to do that, that is fantastic, because, you know, we can all imagine what it's like to reach out to get help. And like you said, Margaret, tell your story that's very emotional. And then the person says, well, you know, we'll put you on the wait list.
Right.
That's a huge piece of this.
Right.
That would
So
be
It's very
extremely-
timely. It should be noted that each referral takes 3 hours from start to finish.
Oh.
So that's an average. It's not all in one day. It's from the intake into the close is in approximately 3 hours of work. So if June and Ayoko get 4 of those a day and they had to do all the matching process, that's what they would do all day.
Okay, and so you're saying, based on this service, that you are basically alleviating what June has presented as the 5 barriers, which was, you know, insurance problems, lack of coverage, long waits for appointments, the cost of care, and all of that. You're basically saying we can guarantee that we can get you an appointment within 2 weeks, rather than if I call up and speak to a clinician and they're putting me out for a month, you're going to be able to get, if it's me, in sooner than if I did this on my own.
Yes, yes, because that's what we know how to do. I get worried about using the word guarantee.
I appreciate that. Yes, okay.
All right, so I
Okay.
don't want that on record, guarantee.
No, that your track record is that you have more success
Yes,
in matching the people. I appreciate that.
thank you.
I
Yeah, but-
had a few other questions, and I'm sorry that
No, go
I'm monopolizing this. I looked at the website, and Northborough is already listed on there as a community that uses your services. Why is that?
Well, again, going back to that we're a nonprofit and we're out to do good. When COVID-19 hit us all, what we made the internal strategic decision to do is to allow those communities that were in discussion with us already to have our service for free for a short period of time. And that's just what we knew, that the need was going to look like a tsunami of mental health issues during this. And we made that strategic decision that it would be important for us to do as much good as we could.
So when did the town of Northborough start speaking to you about this
I'm not
assistance?
gonna
It
remember
was
those.
quite a while ago.
Okay.
Yeah, it was probably late in 2019. And another important point here is that our town manager, John Kader, is in full support of this. And it was going to be in the budget. And then the town had to make some very difficult decisions to furlough and lay off some staff. So they had to come up with some money somewhere because of what's going on with COVID. And that's the piece that one of the things that had to get cut.
Okay, all right. And you had, Margaret, you had indicated that since 2007,
Yes.
it has been in. And based on what you have on your website, there's about 60 municipalities
Yeah.
that have joined. So there's about 350 municipalities in Massachusetts. Are they reaching out to you? Are you reaching out to them? How are people getting connected to you?
Mostly people are reaching out to us. Besides the 1/5 of the communities within the Commonwealth that we serve, we also have 4 state initiatives that we serve. So that's why we are able to have a very extensive database as well. So we're pretty well known within the Commonwealth of Massachusetts for the work that we do. And others who do this work, we're just like June is in a network of individuals who are part of youth and family services. We have those same connections with other services and the Department of Mental Health and working with the substance abuse helpline as well. So
One thing I wanted to mention is several years ago, for the first time, I took an intern from William James College.
no, I didn't know.
And yes, I did. And she was fantastic. It worked out really well. But what I want to say, I've dealt with many, many colleges and universities. They were unbelievable to work with. They also have, it's a PsyD program, a doctorate in psychology. And so I'm a licensed social worker, so we can supervise their first or second year placement, and then they would be supervised by a psychologist after. But they were so easy to work with. And they had this meeting at the end of the year where I was invited. The intern's new placement was invited. The intern brought along a colleague, and there were several professors. And I was so impressed with this whole process of the transition, because I got to speak to the new placement. And this year, actually, I was on the other end of it because we're taking another intern from there. But I can't say enough about the college and our experience with it.
Well, thank you, Joan.
You're welcome.
I didn't know that she did that, so I didn't pay her.
Yeah.
Okay.
The other thing, just to make mention of, this intern that we're taking from William James College, and this speaks to Margaret's comment about the partnership. Because of COVID-19 and because we're not open to the public, I was just concerned that there wouldn't be that face-to-face experience, and it would be a very different experience. And so William James also spoke to me about having that person maybe also pick up some of the people that were being referred to the program. So that's also going to help to give that intern some experience.
Through telehealth, I'm sure. Yes?
Yes. Oh, yes. Yes.
Yeah. And that's an important piece of information to talk about. When the shutdown occurred, we were very instrumental in getting information out to our providers on how to get up to speed on delivering telehealth, how to make sure that they had all of the platforms that they needed, as well as the look at the insurance and how that would work. And I must say that the report back from providers is much better than they thought about delivering services via telehealth. And as a result, we know that telehealth is around to stay. With it, prior to this, insurance companies were not all insurance companies were reimbursing at the same rate as face-to-face. And that was why some providers were not keen on becoming telehealth providers. Yet it also speaks to what was asked earlier about uncovering providers. So telehealth will provide opportunities now for an individual whose particular presenting issue, the location may not be great, but the match is great with telehealth. Then see a provider that's not local, yet
That's
has expertise. And the stigma, if you will, that was around telehealth is now being erased. And that's going to be a very good thing for access to care.
Mhm.
Right. On average, Margaret, and I may be asking you a question that you can't answer. In your experience, how many referrals have to come back to a department like June's because of, inability to get health insurance or inability to find a match?
Yeah. I don't know the exact data. I would have to look at one of the particular communities that also has a youth and family services. And we would probably have to, it would be and if Tanya, who is the person who usually does this, she's on vacation, she's my community outreach person, she would probably have to go through looking at many cases within a town and see if they went back. Yet, I would assume, since June, you did call all of your colleagues and find out whether they felt like that was a partnership or not. If it felt like it was burdensome, you would have heard
Yeah,
that.
I didn't hear that was an issue. I think it would be difficult if we're full, but what I'm thinking of is a lot of these people also have case management needs. So, basic needs like food and fuel, and we could connect with them on that level, and maybe even with the intern sort of have be able to give some support along the way until another clinician is found, if both Ayako and I are full.
Yeah. Thank you for bringing that up, June, because I have heard of that being a particular case study in one of our other communities where it became, like we were talking about before, a partnership where there was a bridge in services while the wait list was going along.
Yeah.
And June and Ayako are clinicians. The individuals on our line are clinicians. So there's what we call often counseling through the match. So counseling to the match, if you will. So the person who is with the presenting need is still having the opportunity to have a connection with a clinician, but yet having started maybe their therapeutic alliance that would become their long-term clinician.
Okay. And what happens after the 2-year contract has been reached? Is it another 2 years, or is it year to year?
It's every 2 years. You sign a contract
Okay.
for 2 years, and we bill though yearly. So to begin, you pay the 16,000, and then
Correct.
following June, you receive your invoice for the next 16,000. We have a very strong track record of not having communities end their contract with us. So that speaks to the fact that it's doing very well and has an impact on access to care within our communities.
Okay. Anyone else have any questions or input? No? Does the committee feel they have enough information to take a vote on this matter? Yes? Okay.
I do, yeah.
All right, so we have to do the votes by roll call, if I understand this correctly. So in the matter of supporting the funding for the William James College Interfaith Referral Service as remarkably brought forth by June Davis Ford. Marcia, how do you vote on this matter?
I support the issue.
Okay, and Karen, how do you vote on this matter?
I support the issue.
Okay, and I also support this issue to provide funds from the Benevolent Fund Committee to approve a 2-year contract for this service. I think it is something that every municipality needs, and I am so happy that there is a resource out there available. So thank you, Margaret, for your time. June, wonderful presentation.
Thank you.
Thank you, Andrea, and thank you, everyone.
Thank you so much for being here. Some of
Yes,
those
thank you.
questions I couldn't have answered.
Well, actually, I'm thinking to myself, y'all, I might be trying to recruit her. She did a pretty darn good job.
June did an excellent job. Yes, she did.
And also, thank you to Jason, because Jason, the finance director, suggested that I invite someone from Interface. And that was brilliant.
Yeah.
That was very smart move.
Very
Thank you.
helpful.
Thank you, Jason. Truly a team effort here, and
Yes.
it makes me proud to be
You're
a
welcome.
townie, so to speak.
Yeah.
So, okay. Thank you. Is there any other business that needs to come before this committee? No? So in that case, I guess we will do a roll call to adjourn this meeting. So Marcia, are you in favor of adjourning this meeting?
Yes, I am.
And Karen, are you in favor of adjourning this meeting?
Yes, I am.
Okay, so we will adjourn this meeting at 3:45 PM. And I thank you all for
Thank you.
taking the time and for giving us this information and providing Northborough with this valuable service.
All
I
right, good
can't
seeing
thank you
everybody.
all enough.
Thank
It
you.
was nice
Thanks so
seeing
much.
everyone.
All right, bye.
Bye-bye.
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 Bye,
Bye.
Margaret.